Shoulder arthritis and arthritis in general is a kind of a challenging concept to understand, but where two bones meet, there's a shiny, slippery, gristly coating on each end of the bone. And in an arthritic condition, that cartilage starts to degrade and wear down to a point where you have bone rubbing against bone. And when that happens, you'll have pain, friction, cracking, popping, trouble laying on it, trouble moving it. At that point, there are a lot of treatment options for arthritis. Sometimes we can give you a shot of cortisone. Cortisone will help grease it up, if you will, but it's a temporary phenomenon. Physical therapy typically is not recommended for arthritis. By having a therapist twist and turn your arm, it can stir things up. And ultimately, when you've reached the end of your road, surgery is recommended. When we do a shoulder surgery for arthritis, we perform a shoulder replacement surgery. There's two types of shoulder replacement surgeries. One is where we place an artificial ball where the ball God gave us was, and place an artificial socket where the native socket is. The operation is done through an incision in the front of your shoulder. It's typically 4 to 6 inches long, and the operation is similar to carpentry, where we use tools like carpenters, saws, and drills to fasten these new parts to your anatomy. The second type of shoulder replacement is a reverse shoulder replacement, and in this case, as the name implies, we put a ball where the socket once was and we put a socket where the ball was. We do a reverse shoulder replacement for a special type of arthritis, a condition where you not only have arthritis between the ball and socket joint, but also damage to the rotator cuff muscles.